A lot of what we call prevention efforts, substance use prevention efforts, are actually early intervention efforts after a behavior has already started to appear. What prevention science tells us is that it is most effective to help young people build resilience to prevent harm before it occurs. That's why primary prevention takes place upstream. One of the key ways that we can engage in upstream prevention is to collaborate with our early childhood partners. Substance use and other problem behaviors that show up during adolescence have their roots in developmental changes that occur earlier, like we talked about. So prevention can be effective at any age, but it can have particularly strong effects when applied early in a person's life, when our development is most easily shaped and a child's life is most easily set on a positive course. So we want to think about moving upstream. We also want to think about creating protective environments. Prevention efforts that focus not only on individual behavior change, but on changes to the environment can really increase the likelihood of positive behavioral and health outcomes. So, creating environments that address those risk and protective factors where we as individuals live and work and play can really go a long way in help preventing substance use. So, this can look like cultural shifts at school, at home, in the community that normalize asking for help, or policies that provide opportunities to connect and support and normalize substance-free opportunities to, connect and engage. An example of a policy that normalizes substance-free opportunities to connect and engage would be something like not allowing alcohol at a youth or family-centered event in the community. So a policy that supports that would be an example of creating a protective environment. We also want to focus on promoting connectedness. When we say connectedness, we mean that feeling of being cared for, supported, right? That sense of belonging. Family, school, and community connectedness is extremely, extremely protective against both substance use and other behavioral health outcomes. When youth feel connected at school and at home, they are far less likely to experience negative health outcomes related to substance use and mental health, in addition to things like sexual risk and violence as well. We also know that youth who feel connected to adults and peers at school has been shown to have really positive effects on things like academic achievements, including like having higher grades, having better school attendance, staying in school longer. So, what this looks like at school and with our communities, we can reinforce positive behavior through praise and recognition. We can work to establish rules and routines and expectations that promote higher levels of connectedness. We can support student-led clubs at school and within community organizations that are really a safe space for students to socialize and support each other and connect with supportive adults. And we can also facilitate positive youth development activities like mentoring programs. So opportunities for youth to connect with adult mentors who can become their trusted adults, because we know that's incredibly protective. Um, so that is what we mean when we say promoting connectedness. We also want to think about teaching problem solving and coping skills. So coping and problem solving skills are extremely critical in preventing individuals from getting to the point of crisis. And if they do find themselves in crisis, equipping them with the tools and the help they need to recover. So we want to broaden conversations we're having around these issues. We can't only talk about what hurts, right? We want to talk about what helps people get through those tough times. So when we're teaching problem solving and coping skills, we want to help normalize recovery, help seeking, and resilience. So normalizing that culture of help seeking, that getting help for a friend is being a good friend, that asking for help is a sign of courage and strength. We can highlight as a community, as a school, as a family, how to get help, where to get help, who we can ask for help, right? And what connecting to help looks like. So some examples of these skill building practices for problem solving and coping skills would be things like social emotional learning programs for youth, parenting skills programs, and then family relationship programs as well. The next thing to prevent substance use is to identify and support people who are at risk. We believe that it's everybody's job to be able to recognize and respond to signs of a substance use challenge happening to those around us. There are several intervention skills trainings out there. One of the trainings that we recommend certainly isn't the only one, but the one that we have the most experience with would be youth mental health first aid. That is a great program that helps you identify when a youth might be experiencing any sort of challenge and how to connect them to help. If we recognize any signs or symptoms of a substance use challenge developing in young people, we want to be sure to follow our school or youth serving organizations policy on how to connect them to support. If we don't have a policy, I feel like that's our cue to advocate for one, right? Another great resource for support would certainly be 988. Utilizing 988 to connect a youth to support is a great resource, right? It's free, it's confidential, it's available 24/7. It doesn't have to be an emergency to use it, and you can call, text, or chat. So that is a great resource to have in our toolbox. Another best practice for schools and organizations would be to implement screening practices. We recommend Youth Expert, so youth screening, brief intervention, and referral to treatment. It's an integrated, comprehensive, evidence-based early intervention that can be implemented in primary care settings to identify, reduce, and prevent alcohol and drug use, misuse, and dependence. So we definitely want to think about our screening practices as agencies, organizations, schools, and then how we then connect a young person to help. One of the ways we can support people at risk and lessen harm and then prevent future risk is to offer cessation resources instead of punitive measures like suspension and expulsion. We want to provide support for substance use with the understanding, right, that it's a disease of the brain and not a moral failing or choice. So when we think about something like catching a young person vaping at school, we want to offer an opportunity to receive cessation and treatment resources and education as opposed to suspending or expelling them because we know that they need support to be able to find recovery from that substance. One of the ways that we want to lessen harm and prevent future risk as well is to connect young people to treatment if they need it. The first step to accessing treatment is to get an assessment. Many places do assessments. DECA is one of them. RADAC is another one that's very familiar to folks in Kansas. So it's good to know who offers youth substance use assessments in your area. Some schools may offer substance use treatment services as well as screening or prevention programs. So if a young person is ready and willing to make a change, our support is absolutely critical. As I mentioned, changing those habits around substance use is not easy. And we know that addiction is a disease. So willpower and self-resolve are not always enough to help the young person stop using substances. A young person might try to change or stop substance use more than once before they're successful. It's also important to understand that reoccurrence or relapse is a common part of the recovery process. So if a young person finds it difficult to give up the substance, altogether, cutting down is still worthwhile. However, we want to know what treatment options are available in our area to help connect a young person to that support that they need. So treatments certainly help manage addiction, but there is no cure, right? It's considered a chronic disease, meaning it lasts a long time. It needs to be managed with regular treatment. However, it's important to share with young people who might be experiencing this issue that people who follow treatment plans can go for many years leading healthy lives. It can be similar to other chronic conditions that people learn to manage, right? Like type 1 diabetes or heart disease. Generally speaking, for the youth you might be engaging with, there are two types of treatment for drug addiction. So behavior change, helping people learn to change the behaviors that trigger drug use, right? And medications, helping people manage cravings for some drugs like tobacco, alcohol, heroin, other opioids as well. So young people might have questions around that. And so it's important to know that information. It's also important for them to understand that the length of treatment might vary depending on a lot of factors, including the length of use, the amount of use, that type of thing. And so the most important thing that they can do is get that assessment and get connected to help so that they can work with that specialized individual to create a treatment plan that works for them. We also recommend young people talking to their primary care provider if they have access to one for more information on treatment. That's a great resource there.